Can we start over the wait? Can we start over the wait?
Yeah, go ahead.
Welcome. I'm Dr. Goldstein and this is Dr. Skora. We are with Fertility Specialists of Texas. I hope y'all are find the conference very educational. It's like an incredible amount of information. I don't know if this is your first conference or second conference, but I know when I first started coming to these conferences, I was like, I don't know how people even have a kid when you think about the number of steps that you going through the process. So we just wanted to give you all a little bit of information about our practice. And I'm the medical director. Dr. Skora is one of our reproductive endocrinologists as well. And we are based in Texas, as Dr. Skora mentioned earlier. I know one of the first questions that people ask is, Texas is like the land of Rick Perry. And believe it or not, it's actually a very friendly surrogacy state, which is why we do a lot of surrogacy, as well as very, very cost effective.
The other question you're probably thinking is, did we coordinate our outfits? We did not.
Right. Yeah, that's true. That's it. Yeah.
I'm not wearing the exact same outfit in this picture, but it is the same tie, square. Spring, why not? So why choose LGBT fertility? You're going to see LGBT fertility as well as Fertility Specialists of Texas. Those are interchangeable, okay? The reason as I was saying in my little speech, that you should choose us is multifold. But for me, it was why did I choose to become a doctor in this practice? It was because of things like this. Because Dr. Goldstein, as well as other partners in the practice, have been involved in LGBT community for a long, long time. We were involved in local as well as international and national organizations. Last weekend we walked in the Pride Parade. That's me with my dog, Kugel. It's not a great picture of him. He's much cuter than I am. But and then the rest of the team who came out with us to march in the parade. It was probably 100 degrees. My boyfriend's dog almost died. It was a serious moment, but it was really fun and it was a great experience.
So one thing that is, whether you're looking at us or whether you're looking at any clinic, it's important to look at the experience of the clinic in terms of dealing with people that are using surrogates. We have like a whole division in terms of that helps men through the initial process from the time you walk in the door till we send your surrogate off to the OBGYN. I would say that one thing that distinguishes us is that we have invested a lot in terms of our IVF lab. We did over 1,000 IVF cycles last year, and we have high success rates. And those success rates have allowed us to offer programs that some clinics are able to offer and other clinics aren't, but because of our success rates, which is basically taking home a baby, that we've done very well, and I think that's one of the distinguishing factors of our facility. And you could see that in terms of people that are using an egg donor, gestational care, about 75% of the time do you take home a baby.
So that's an important thing to look at when you're looking at success rates among clinics. Is you want to compare, if you decide most of our patients, same-sex male couple patients, are now using PGS, or you'll see PGTA. I don't know if they've already talked about it today. Tomorrow at the medical panel we'll talk about that. But it does increase your chances of pregnancy, because what we're doing is we're selecting the embryos that we know are normal, genetically normal, so it increases your chance of pregnancy, as well as decreasing the chance of miscarriage. So, we're looking mainly at this category, unless you bring an egg donor like a sister or something like that, and that might alter the success rate. But generally, even in higher age range egg donors, if it's a sister or something like that, or a cousin, you're still gonna, if you have a genetically normal embryo, you have a very good chance of pregnancy as well. So as Dr. Goldstein was also saying, our on-site IVF lab is led by our very well-known scientific director, Carlos Guerrero. I think that is him in that picture. Yeah, it's hard to tell. And we have 5 other embryologists as well. So it's a very large lab. We're doing IVF every day of the week. They come on every day of the weekend to check on embryos, to give you a call, all those kinds of things. We have great safety protocols and amazing success rates as a result of that.
The first step, obviously, is meeting a provider and feeling comfortable with the provider and seeing if it resonates as well as with the team, which plays a very important role. We have members of our team here, Sarah, Nicole, and Tessa that come to the meeting, and you would come to our clinic and, and bank sperm. And then the second thing would be picking out an egg donor. We have an in-house egg donor program, as well as we use agencies. I always tell people that if you're looking for someone that's like 6'3" and has like an SAT score of 1800, we probably don't have that person. But it is more cost effective when you use a practice that has an egg donor program where you can do kind of most of the procedure in terms of it's done at one facility. Our donors are pre-screened. They're the donors that we've actually seen, and they're local. So obviously it doesn't matter to us literally whether you use one of our donors, whether you use an agency donor. They go through the exact same screening process, but that is something that we've worked to develop. We don't have the selection that an egg donor agency has, because it's like that's not our main focus is really making babies, but certainly it's something to at least look at.
Did you participate in GPAP? We do unlimited stage 1 cases, and we do 1 stage 2 case annually. So if you're involved in GPAP, if you've applied for GPAP, it's a great discount program through our clinic as well. We work with all different surrogacy agencies around the country. A lot of people, they say, what's this kind of Texas advantage? There are surrogacy agencies that are located in Texas. And sometimes, when we're talking about the egg donors and the surrogates, if they're all in one place, there's less travel expenses, et cetera, it can make it cheaper. But we work with surrogacy agencies around the country. So if you find a gestational carrier that lives in California, we will try to make it as easy as possible to bring them out only when they need to be brought out, et cetera. And we work with clinics around the country to do outside monitoring if needed as well. So also another reason is, even though you might think Dallas is this Texas is this red state, it's actually very conveniently located to everywhere because it's in the middle of the country, correct? So it's a very surrogacy-friendly state. Your names are put on the pre-birth order, so your names are on the birth certificate. You take baby home that as soon as they're released from the hospital, you are their parents. We expect, analysis has been done by surrogacy agencies as well as us in terms of the cost savings between doing the entire process on the coast is a savings of about $30,000 to $50,000. So it is a significant cost savings because there is no sales tax in income tax in Texas, and therefore we can surrogates are paid less, all the employees and all the different fields are paid less, costs in general are less, and we pass those cost savings on to you guys.
So I don't know if y'all have any, obviously there's a lot of, I'm sure y'all heard a lot of information at the conference so far. If y'all are certainly open for any specific questions about anything, feel free to ask questions now. Certainly we have a table set up, or, and we have doing consultations today, but it's, I know myself, I can tell you that I have 2 boys, and it's like my life is different. And so, kids are amazing, and we want, that it's a life-changing experience, and we want to help you through the journey. Questions?
What are your success rates with frozen eggs?
With frozen eggs? Yes. In general, they're about 10%. And first thing is we've done certainly. Most of our patients that have done frozen eggs are patients of ours that are like an egg donor that we've had, that we've inseminated 10 of them, then we froze the other 10, as opposed to having eggs that come from a third-party place, egg bank. It's about 10% less than what it is in terms of doing not using frozen eggs. One of the concerns is, intuitively it makes a lot of sense. You're like, wow, you take an egg basically almost like off the shelf. It's already been screened and things like that. But I think that you need to consider, one is whether you are planning on having one child or whether you're planning on having multiple children, because typically it takes about 5 or 6 eggs to make one baby. And there is variability with the egg banks in terms of success rates, because it's like that when you're using an egg bank, then the eggs are typically produced at other clinics, and then they are sent to the clinic that you're using. And so it's hard to really know what the success rates depend in large part on what the success rate of where the clinic is that they were developed in. And so I think that it's we certainly aren't. It's most of our patients pick out an egg donor, and if they're doing split insemination between you and your partner, then all those eggs are devoted to you as opposed to using an egg bank.
I think the other important thing to consider is if you want to use an egg bank, it's fine. Generally, you're going to get lots of 6 to 8 eggs from an egg bank, okay? And generally, they'll guarantee maybe one day 5 embryo, okay? You can have them inseminated at the egg bank or at the fertility clinic, so those are options as well. Often they'll give you more of a guarantee if you can do it with them, okay? The other important thing is if you plan to split insemination, you want to use both partners' sperm. It's really important to know you're only going to have 6 or 8 eggs, right? And you're only expecting 1, maybe 2 normal day 5 embryos out of those 6 to 8 eggs. So you're really cutting it close with that one group. When we do our own in-house or external egg donors, these are generally women in their 20s, we can only get an average of 20 to 30 eggs with that one cycle. So yes, you might spend, I don't know, 3,000, 4,000, 5,000 more. You're getting a lot more for that amount of money, and a lot more reassurance, I would say, as well.
Other questions? Uh-huh. Pardon me?
Screening for the egg donors?
So the question was what?
What's the screening for the egg donors?
Well, so the screening for the egg donor, obviously egg donors are typically 21 to 29 years of age. They have certain, non-smoker, healthy, that's weight's appropriate for the height. And then they have blood tests. And I think that Dr. Skora is actually going to be on a medical panel tomorrow where they're going to talk about specific screening. But typically, the most important test is really like an AMH test. And so we want the AMH to at least be over 1.5, and it gives you a rough idea of how many eggs that you can expect from a donor. But we do the screening so they have screening done in our office: HIV, hepatitis, routine blood work, drug screen, tox screen, genetic screening for like any type of cystic fibrosis, Fragile X, and then psychological screening, and then lastly legal, where the egg donors understand that those eggs are going to be your property contractually once they go through the stimulation process.
We also do chromosome testing,
Yeah.
Which is, I know that we are one of the very few clinics that do that extra testing to make sure that they're not a carrier for any chromosome.
No, well, so we do, when we do the screening, all clinics do screening to make sure they're not a carrier, but there's also something called a karyotype, where you make sure that genetically that there's no sort of translocation or missing chromosomes, that would make it be an issue. But it's like whether they come from a donor in a house or from an agency, we do the same screening.
Any other specific questions? Feel free to come up afterwards as well.
I know it sounds like it's a very, I can tell you myself that one of the things that's really impressed me and why we have developed, why we've been, an interest in that myself is that it's always been amazing to me how much y'all spend in having a kid. And you hear stories of people that go into clinics and spending $80,000, $90,000 and end up with zero. And it's obviously the process is not 100% by any stretch, but in terms of our commitment to get you through the process, having a baby, which is really what matters, not whether you have embryos that make it to day 5 or things like that. You're interested in having a baby, and so we are committed to making that happen. And I think if you talk to agencies that have worked with us, they'll tell you the same thing that we've done. That the extra step in terms of to stick with you in terms of to make sure that it happens, because it's like, because it's we want it to happen. No other questions? Anything?
They're all overwhelmed.
Huh? We're.
What's your time frame from signed contracts to baby in the arms?
So that depends. It depends on coordination with the surrogacy agency. So if everything's overlapping, everything's set, you have a gestational carrier ready to go, when we have the egg donor ready to start, you can be as short. I don't know about baby in the arms, but releasing to an OB is about
6 months, maybe.
Yeah.
I mean,
4 or 5. As fast as possible, but Average, I would say, is longer than that.
It depends on, like, the biggest thing, obviously, coming and collecting is like,
A day.
yeah, it's a day, but in terms of picking out, then you have to pick out an egg donor, so it depends whether, if the egg donor's been a proven donor or it's the first time she's been a donor, where she lives. So, I always like to say that fertility is a lot of hurry up, wait. And so, but I would say at least, typically 6 months at the, minimum to get, everything in order.
Some service agencies take much longer to match than
Yeah.
others, so
Yeah.
we need to talk about what's your average match wait time.
Yeah.
Because if you want to have a baby now, you want an agency that can match you quickly. So
The legal aspect can hold you up as well. When the legal contract is coming out, it's gonna sometimes bounce back and forth for changes, updating. So typically with an egg donor, legal can be completed in roughly 2 weeks. As an in-house donor program, we do the legal contract, which is done on the same day as the and then when you're using a gestational carrier, that can typically take 6 to 8 weeks for the legal. So it all depends on how fast you are and how many changes go on. Can also kind of hold you up a little bit, or it can go extremely fast.
all right, I think our time's up. So if you have any further questions, we'll be outside and as well as in our desk, and we'll be having, if you want a personal consultation, just let us know and we can fit you into our schedule this afternoon. Have a good rest of your
Yeah.
conference.